Welcome to Beyond the Basics, a project of the Center on Budget and Policy Priorities that is designed to help prepare advocates, assisters, state and local officials, and others to assist people in understanding the Affordable Care Act's health coverage options and obtaining coverage. Today's video is about the Healthcare.gov renewal process for 2018 coverage, and will cover both the process for plan enrollment and redetermination of eligibility for premium tax credits. Throughout this presentation, I'll be discussing two processes that Healthcare.gov uses when consumers don't come back to shop: redetermination and auto-enrollment. Redetermination is the process Healthcare.gov uses to redetermine eligibility for 2018 Advanced Premium Tax Credits, or APTCs, and cost-sharing reductions, or CSRs, when consumers don't take any action. Auto-enrollment is the process that Healthcare.gov uses to determine which plan consumers will be enrolled in for 2018 when they don't take any action. So the renewal process begins with notices. The first type of notice current Marketplace enrollees will get are Marketplace Open Enrollment notices. These include reminders about the importance of updating application information and comparing plan options so that consumers can get the best deal available. They also detail how the Marketplace will redetermine APTCs and CSRs for 2018 if people don't come back to update their eligibility. Importantly, for certain groups where the Marketplace cannot redetermine eligibility for APTCs and CSRs, the notice contains a warning that if they do not come back to Healthcare.gov to update their information, they'll be re-enrolled without tax credits or cost-sharing reductions. Current Marketplace consumers will also get notices from their insurer that will let them know if their plan is being offered again in 2018, and if so, any changes to that plan. The notice will include premium costs for 2018 and will take into account any APTCs that an enrollee is currently receiving. It's important to note here that the APTC amount in the notice will not reflect redetermined eligibility for APTCs. It's simply going to list the APTC amount that a person is currently getting and subtract that from the unsubsidized premium cost for the 2018 plan. This means that the actual premium amount a person would pay for 2018 may be different than what is listed in the insurer notice. People who continue to qualify for APTCs in 2018 may have larger subsidies because of the cost of benchmark plans has substantially increased, and the subsidy amount reflects the cost of benchmark plans. This is another reason why it's important for consumers to return to the Marketplace to explore plan options and pricing. If the 2017 plan is being discontinued, the enrollee will receive a discontinuation notice stating that the plan is no longer available. If another plan is available through the same insurer, the notice will have information about the new plan that the person will be auto-enrolled into if she doesn't come back to the Marketplace and choose a different plan. But if the insurer is no longer offering plans in the Marketplace, then the person will be matched with another plan with another insurer by the Marketplace. But that notice from the 2017 insurer will not have any information on that matched plan. It's only going to have information about the discontinuance of their 2017 plan. When a consumer's 2017 plan is discontinued and they are matched to plans provided by a new issuer, they will get notices from the new issuer and from the Marketplace. That Marketplace notice is referred to as the cross-issuer notice. It should include the name of the new plan and the insurer that provides it, along with information about how to view other options and compare them to the cross-issuer match. It also tells consumers how to activate a special enrollment period when consumers are in this situation. It's worth noting here that people who are auto-enrolled in a new plan with the same insurer will not get this cross-issuer notice. So how will Healthcare.gov auto-redetermine APTCs and CSRs? Well, before open enrollment begins, Healthcare.gov is going to go through a sorting process. It's going to check the latest IRS records available, which for this year will be the 2016 tax filing. Based on that information, it will determine the kinds of notices that people will get and sort them into two groups: those that can be auto-enrolled with APTC and those that can't. Anyone who comes back to the Marketplace will get their APTC recalculated based on updated information that they provide to the Marketplace, including an income projection for 2018 and access to employer-sponsored insurance, as well as updated federal poverty line thresholds and benchmark premiums. That's why it's so important to emphasize to consumers that they should come back to Healthcare.gov to update their information and check out other plans to ensure that they will be enrolled with any financial assistance that they are eligible for. So now let's talk about who is eligible for auto-enrollment with APTCs and CSRs. There are two general groups of current enrollees who are eligible to be auto-enrolled with APTCs and CSRs, the standard group and the income-based outreach group. These groups are pretty similar, but they will receive slightly different messaging in the Marketplace open enrollment notices that they received before open enrollment. The standard group is anyone who authorized Healthcare.gov to pull tax data related to income and household size, has income within the range of PTC eligibility, and does not fall into one of the special groups that cannot be redetermined. The income-based outreach group is a group who may be at risk of being ineligible for premium tax credits because their most recent income information shows income at the margins of the APTC eligibility. It will also include people whose 2016 tax income shows big swings when compared to their 2017 projected income. This group will still have APTC and CSR renewed using the most recent income information, but they are at greater risk of receiving an incorrect amount of subsidies in 2018, and they should return to the Marketplace at any time to update their eligibility information. Then there are the people who won't be able to get their advanced premium tax credits in 2018 unless they go back to the Marketplace. Here there are four groups. The first group includes people who didn't give Healthcare.gov consent to check their tax records. When people first applied for APTCs, they were asked to give Healthcare.gov consent to check the IRS data for 5 years. Most people said yes, but there were a small number of people who said no. This group cannot have APTC redetermined and will need to return to Healthcare.gov to update their information, and if they wish to have their eligibility auto-redetermined for 2019, they can give that permission for future years when they update their application. The second group of people includes people who got advanced premium tax credits in 2016, but IRS records show that either they didn't file a tax return for 2016 or they filed a return but didn't reconcile premium tax credits that they received in that year. Reconciling APTCs is a requirement. If a person received APTCs in 2016 and did not file a tax return to reconcile her APTC for that year, then the Marketplace will discontinue APTCs for 2018. Some consumers will have reconciled their 2016 APTCs by the time open enrollment begins. If that has happened, they can go back to Healthcare.gov and check a box to attest that they reconcile their APTC. Healthcare.gov will then verify whether people actually filed. The third group are people whose 2016 tax return shows they have income above 500% of the federal poverty line, and therefore they no longer qualify for APTCs. They won't get APTCs unless they come back and update their application with information that shows that they are still eligible. And this is possible. Perhaps 2016 was an unusual year for them. Maybe their income has fallen since. But unless they come back and update their information, they will get auto-enrolled into a plan without APTCs. A final group of people are those who were auto-renewed for the past 2 years and haven't returned to Healthcare.gov to update their eligibility for those 2 years. These are called repeat passives. This group will also be auto-enrolled without tax credits or cost-sharing reductions for 2018 if they don't come back to Healthcare.gov. It's important to reiterate that people who fall into any one of these four groups and who don't take any action are still going to be auto-enrolled in their same plan or into a similar plan, but they're going to be auto-enrolled without APTC for 2018. Now we're going to look at a group of people who will not be renewed for any coverage in 2018. Because insurers are not legally allowed to sell a policy to someone they know is in Medicare, if someone enrolled in the Marketplace coverage is also enrolled in Medicare, then the insurer will terminate that policy at the end of 2017 and cannot renew that policy for 2018. This means that any individual who shares a policy with a person enrolled in Medicare will not have coverage renewed for 2018, even if they continue to be eligible for enrollment. So people in this situation who are not enrolled in Medicare should return to the Marketplace to re-enroll in coverage. A special enrollment period will be available until March 1st, 2018 for people to re-enroll in coverage. They can choose to have their coverage begin retroactively to January 1st to avoid any gaps in coverage. When Healthcare.gov redetermines eligibility for an enrollee's APTC, it uses the updated federal poverty line thresholds. It also has the ability to take into account the cost of new benchmark plans. For income, Healthcare.gov will use the most recent income information that's available to it. There are 3 options for income information that will be used. First, it will use a consumer's projection of their 2017 income. If that's not available, it will use income from their 2016 tax data. And absent that, as a last resort, Healthcare.gov will use a consumer's projected 2016 income. Whichever one of these 3 options Healthcare.gov uses, it will take the income amount and adjust it to 2018. That adjustment factor will be the rate of growth in the federal poverty line for the applicable family size. So how does that work? Let's say that Healthcare.gov is using 2016 income data for a single person. Healthcare.gov is going to take that 2016 income and adjust it to 2018 by applying the rate of growth in the federal poverty guideline from 2016 to 2018 for a single individual to that person's 2016 income. Healthcare.gov adjusts income estimates so the income amount reflects the same percentage of the poverty line as the 2016 data that Healthcare.gov has. So let's walk through 2 examples. Let's talk about Katie. Katie was enrolled in 2016 and came back last year to update her information and re-enroll. We'll use her most recent income information, her projected 2017 income, as the amount to be adjusted. You just multiply the income that you do have by the adjustment factor we discussed in the last slide, and you'll get the 2018 adjusted income amount that is the same federal poverty level for the applicable family size. What about Sasha? Her most recent income information that we have is her 2016 tax data. Again, we multiply her income by the adjustment factor, and this factor is a little higher because we are adjusting 2016 income to 2018. For Katie, we only adjusted 2017 income for 2018. Like Katie, Sasha's adjusted income is going to be at the same level of the federal poverty line. Healthcare.gov also takes the new benchmark plan for 2018 into account when redetermining APTC amounts, which is really important. This year, benchmark premiums have increased substantially. So here's Katie again. She's going to have her tax credit auto-redetermined for coverage in 2018. In 2017, her income was $17,000, or 143% of the poverty line, and she received APTC of $2,112 in 2017. This is because her plan was based on a benchmark costing $2,735, and her expected contribution was 3.66% of her income, or $622. In 2018, her expected contribution is going to be 3.61% of her income, so pretty similar. But for 2018, the cost of the benchmark plan is much higher, $3,851. Because she is being auto-redetermined for APTC in 2018, her income is adjusted to $17,258, or still 143% of the poverty line. The APTC is going to absorb the rest of that cost increase, and her redetermined APTC is going to increase from $2,112 in 2017 to $3,228 in 2018. Now let's discuss the auto-enrollment process for 2018 plans sold on Healthcare.gov. If a person takes no action by December 15, 2017, they are going to be enrolled in the same plan as the previous year if this plan is available. Healthcare.gov is going to adjust the APTC amount based on the auto-redetermination process that we've discussed today. And the notice from the insurer is going to have the information consumers need about premium costs. But if this first option is not available, there is a hierarchy of options that Healthcare.gov will use for auto-enrollment. The next option is to enroll the consumer in a plan with the same insurer that is as similar as possible to their current plan. In this case, the notice from the insurer will have information about both the discontinuance of the person's current plan and information on the new plan, including premium costs. If this option is not available either, say the insurer has left the market entirely or is not selling plans in the person's service area any longer, then Healthcare.gov is going to use the third option, a new plan with a different insurer that is as similar as possible to the current plan. But be sure to remind consumers here that they can come back to Healthcare.gov at any time during open enrollment to pick a different plan. But remember that open enrollment is shorter this year. For plans sold on Healthcare.gov, open enrollment ends on December the 15th. In previous years, open enrollment ended after the auto-enrollment process took place, but that's not true this year. So consumers really should be encouraged to come back before December 15th to update their information. Let's take a look at key things to remember for consumers who can be auto-enrolled in the same plan. Note that premiums, benefits, and cost sharing may change from 2017 to 2018. The notice consumers receive should outline what the 2018 premium will be and any changes to that coverage offered under the plan. Consumers will be able to return to Healthcare.gov until December 15th to pick a different plan, and if they do nothing, they're going to be auto-enrolled in the same plan. Consumers have until December 31st to cancel their plan and not have to pay any premiums for 2018 coverage. But just remember that if you cancel your plan between December 16th and December 31st, you will not be able to pick a new plan. So what about consumers enrolled into a new plan with the same insurer? Like those enrolled in the same plan, these consumers will get a notice that outlines premiums, benefits, and cost sharing. They will have the same deadlines of December 15th to come up to Healthcare.gov to pick a new plan and December 31st to cancel the plan that they're auto-enrolled into without having to pay any premiums in 2018 for the coverage that they're canceling. Different for this group, though, is that they will be eligible for a special enrollment period due to the fact that the plan they previously had was discontinued, and we'll talk about that special enrollment period in more detail shortly. But first, let's also discuss people matched to a new plan with a different insurer. Consumers could end up in this situation because both their 2017 plan was discontinued and their insurer is no longer selling plans on Healthcare.gov in the person's service area. For these consumers, they will be matched to a new plan with a different insurer. Consumers in this group will receive a discontinuation notice from their current insurer. They will also get a notice from Healthcare.gov letting them know that they've been matched to a different plan with a different insurer, but they are under no obligation to enroll in this plan. The new insurer is also going to send a notice detailing premiums, cost sharing, and coverage details for the new plan, along with information about how to pay the first month's premium. It's important to note that people in this situation have to pay their first month's premium to effectuate their coverage. If those enrolled in a new plan with a different insurer don't pay their first month's premium, their coverage will not go into effect. Consumers in this group will also be eligible for a special enrollment period due to the fact that last year's plan was discontinued. So now let's talk a little bit about that special enrollment period. For both consumers auto-enrolled in a new plan with the same insurer and consumers matched to a new plan with a different insurer, they are going to be eligible for a special enrollment period, or SEP, because they lost qualifying health coverage. This SEP is going to allow them to switch plans for up to 60 days before their plan is discontinued, as well as 60 days after their plan is discontinued. So for plans that are discontinued at the end of 2017, their cancellation date is going to be December 31st, 2017. So let's look at another example. Katie is enrolled in 2017 coverage, but her plan is no longer going to be available in the marketplace in 2018. She receives a discontinuation notice from her insurer informing her that her plan is no longer available, and she receives a cross-issuer notice from the marketplace letting her know that she has been matched to a new plan with a new insurer. She returns to the marketplace after open enrollment has closed. She has been redetermined for APTC for 2018 using her most recent income information, but she expects to make more money in 2018. She updates her application and her APTC eligibility is recalculated. When she updates her application, she must reselect a plan for 2018. The matched plan that she has been auto-enrolled in shows up at the top of her options during plan selection. She likes the plan and pays the first month's premium, effectuating coverage that will begin on January 1st. But what if Katie did not like the plan that she was matched with and wants to pick a different plan? Can she change plans after open enrollment has ended? Well, the answer is yes. Because her 2017 plan was discontinued, she is eligible for a special enrollment period due to the loss of other coverage. When she updates her application, she must note that she is losing coverage on December 31st, 2017, and this will unlock the SEP. So if she wants to pick a different plan before the new coverage year begins, then she can do that, and her coverage will begin on January the 1st. But what if she wants to change plans after January 1st once she's already auto-enrolled? Let's say that she discovers her doctor is not in network in the plan that she was auto-enrolled into. Can she change plans? Well, again here the answer is yes. She is still eligible for the SEP 60 days after the end of her 2017 plan, so she can use that SEP to change plans. However, she may only be able to pick a plan within the same metal level as her current 2018 plan because of plan selection restrictions on the current marketplace enrollees. And what if she never effectuates coverage for 2018 and isn't enrolled in any plan come January 1st? Can she enroll in coverage? Again, here the answer is yes. She can use her SEP to enroll in coverage up to 60 days after the end of her 2017 coverage. Note that she will have a gap in coverage in this case, but she will still be able to enroll in 2018 coverage. Finally, we'll close with a couple of tips for assisters as it relates to auto-enrollment. First, always remind folks to come back to Healthcare.gov to update their information and shop for plans. There are good deals to be had on Healthcare.gov. 80% of consumers on Healthcare.gov in 2018 are going to be able to find plans for under $75 a month after counting financial assistance. Next, remind people about the end of open enrollment. It's coming sooner this year. It's on December 15th. Also let consumers know that if they receive tax credits in past years, they need to file a tax return and reconcile their APTC. And finally, use previous income data for 2016 and 2017 to help consumers make a more accurate projection of their income for 2018, especially if their circumstances fluctuate. This is going to help ensure that consumers get the right amount of financial assistance. And for anyone who is curious, there are a lot of good resources on some of the premium increases that happened this year. Kaiser Family Foundation released a report that looked at trends in the premium increases and found some really interesting things. Premiums for silver plans have risen much more than other metal levels because of the termination of cost-sharing reduction payments. This means that the APTC for 2018 will be much higher this year than in previous years because the credit is calculated using a benchmark silver plan. Larger tax credits will make bronze plans much cheaper and will even make some of them free for many low-income individuals. Also, in some places, an unsubsidized gold plan is actually lower cost than a silver plan, so people, especially those without financial assistance, should take a look at these plans available on the marketplace before choosing a plan. So that concludes this video overview about auto-renewal and auto-enrollment processes for open enrollment for 2018 coverage. You can find more information about this video series, including links to these slides and contact information for Beyond the Basics in the description of this video below. You can also find more materials from Beyond the Basics at our website, healthreformbeyondthebasics.org. And if you have any questions or need any assistance going forward, please email our Beyond the Basics contact email. That's beyondthebasics@cbpp.org. And we will talk to you again soon.